Good morning, everyone. My name is Estefania Rodriguez. I am about to graduate from the Master of International Development Policy at Duke University, and I'm sponsored by District 4185. And well, thank you so much for being here. And a little bit I want to say something before I start with the topic, that this is related to my master's project, and this is also related to a big project at Duke University called Latin 19. So I'm going to talk about Latinos Called Journey, which is a community-informed policy project in North Carolina. So this is the way that my presentation is going to be structured. I'm going to start talking a little bit about my health journey, then how I ended up working in health policy in the US, thanks to this project, how I've been involved in Latino population, work in North Carolina, and how this has turned into community-informed policy. So my journey started in Mexico in nutrition and health policy. And this started back when I was in college, when my father was diagnosed with diabetes, which is the #1 non-communicable disease. And I started seeing that other family members and acquaintances and family friends were also getting similar diagnoses. And I started wondering, like, okay, this is a disease, it is serious, but there are like some other issues that are not only medical issues. And I don't have a medical background, but it was something that caught my interest because I became aware there was another area called social determinants of health. And so right after college, I started working at the health department in Mexico. And that's where I started seeing like a lot of the data and like the reasons why a lot of people in Mexico were having a bad quality of life and or were suffering or living with some non-communicable disease, such as diabetes or obesity or other things that are also related to bad nutrition. So first of all, like I wanna put here like this quote that is in the Rotary International website. And this is why also I think health is important, like overall, but also like for Rotary, because good healthcare is everyone's right, yet 400 million people in the world can't afford or don't have access to basic healthcare. And so in the United States in 2022, 26 million of Americans didn't have health insurance, which is 8% of the population, which means that there is a development issue in a highly developed country. And so I also like started thinking about how could I contribute to something here. And well, mostly like, and based on my interest in the past is because social determinants of health are non-medical factors that influence health outcomes. And also given that health equity is one of the core aspects of these big projects. So health equity is basically ensuring that all individuals have the same opportunities to be healthy, regardless of their background or circumstances. So this is a glimpse of how health disparities are in North Carolina, and this is mostly related to the Latino population. So there are over 1 million Latinos in North Carolina currently, and 1 in 3 Latino individuals don't have any type of insurance. And this has led to health disparity that persists due to many barriers that we're going to see in the rest of the presentation. So the rate of uninsured people in North Carolina from Latino ethnicity is 31%, which is the highest among the rest of the ethnic groups. And so for this project, it is very important the participation and involvement of community health workers, because they are the ones that help bridge the gaps and provide support and help anyone access the healthcare system in the US, not only for Latinos, but for everyone. So where did the Latino population came from? So mainly from Mexico. 38% of Latinos in North Carolina claim Mexican heritage, and 18% of them claim Central American heritage. And the countries in Central America are Guatemala, El Salvador, and Honduras. And so this is an opportunity for people from these countries or that have families from these countries or travelers to these countries can get the benefit of enrolling in Medicaid, especially after the expansion that took place last year. And this is part of like a national thing, which is the Affordable Care Act. And so this is targeted at low-income individuals, and a lot of the Latino population are part of that low-income demographic. So it is an opportunity for Latino people to join the system. And so Medicaid is a federally and state-funded program made of low-income individuals. And as I mentioned, like thanks to the expansion, there is more opportunity for people to join. And they also have to be eligible, which means adults from 19 to 64 years old that have an income up to 138% of the federal poverty level and that whole legal status in the state. And so to address this, I worked with some strategies to increase Medicaid enrollment among Latinos in North Carolina. And this is based on two aims. The first one was to explore the perceptions and knowledge of healthcare among the community health workers. And for this, I analyzed the information that came from three focus groups with community-based organizations that work in Latino issues in the state, and also with community health workers to better understand what are like the main barriers and constraints why people are not enrolling in the system. And the second aim was to understand how the healthcare system in the countries of origin may inform strategies to promote Medicaid enrollment among Latinos in North Carolina. And so for this, I created a tool to compare the systems of the countries that I mentioned before and how these systems are similar or different to Medicaid. And so people maybe that in one point of their lives access to those health systems or like their family access, they can be able to understand what is Medicare about and how can they access and why is it important to have health insurance. So it is crucial to enroll Latinos in Medicaid because they have been historically marginalized. And some of the benefits of helping people enroll through healthcare workers, community health workers, is to access affordable healthcare, to then be able to reduce health disparities among all the ethnic groups, because this is like a social benefit for everyone to gain financial protection, especially in terms of an emergency, to improve their economic integration in the state, and to enhance health outcomes, and like finally and overall for community well-being. And so after analyzing the focus group results, I came up with some key themes and insights, which are based on what the community-based organization leaders and the community health workers were saying. So awareness and understanding of health insurance came up first. And it means that people, Latinos, have limited knowledge and misconceptions and fears. It means that some of them don't know what is healthcare, what is health insurance, why do they need it, and why is it useful, and also some misconceptions and fear are based on things that they have heard or read about accessing a social benefit, and that is something that might affect their legal status or something like that, which in a lot of cases is not true. And there are other barriers to enrollment, which is like that most of the information is in English, and sometimes it is in Spanish, but it's not like adequately translated. And even if they know the word, they don't know what they mean. And there are also some priorities for improvement, which are some educational initiatives that could be implemented through community health workers. And they also suggested some methods of delivery, which is like related to having digestible materials in both English and Spanish, and using digital platforms like to inform like everyone, not just like people that maybe have a critical condition and they need to access the healthcare system. And so then to understand how to implement these community recommendations, with the tool that I mentioned before that compared the healthcare system, and with the review of the tool by experts and at the same time are representatives of the countries like Mexico, Guatemala, El Salvador, and Honduras. I was able to review the tool. They gave like their insights and approval. And in that way, the tool was like, you know, reviewed like to complete this step and have the most accurate information. So when we deliver this to the community, it means that it's gonna be like official and validated. And so finally, the community-informed policy recommendations were to strengthen community health workers programs to improve healthcare access, to disseminate the toolkits in the consulates and the health department of North Carolina. This like mostly because many people still have family members that are still nationals from the countries that I mentioned, or that hold dual citizenship, and in some way they still have some connection and or visit the consulates, and that's a way to bring their attention into enrolling Medicaid. And also it is important to assist Latinos in North Carolina to access healthcare, and this could be done with the help of community health workers. And so all of this is related to my journey and future career. And over the last couple of years that I've been here, I've been able to gain new perspectives on health. I've been able to work with amazing people at both Duke and UNC, and to be involved in this project is such a blessing for me because it allowed me to better understand what community engagement means and how community can better inform policies, and to be able to co-create policies by and for the community, which is something new for me. I mean, I know a lot of people have worked with that, but in the past, when I worked in policy in Mexico, it was more focused on just giving recommendations, thinking of what will be better for people living with nutrition and health issues. So this is very meaningful for me, like being able to work with the people that are gonna be benefited by these types of policies. And this has also been very helpful to increase and to, you know, keep building my service and leadership skills that are the core reason of why I joined this fellowship. So what I hope, like, overall is to go back to my country and implement what I've learned here, and how to better engage with the community and how to help them to access the healthcare system. And also I will be so grateful if I get the opportunity to work with community health workers back home. And so finally, I would like to thank Latin 19 and Duke University for providing the data for this project, and well, most importantly, Rotary, because without Rotary's help, I wouldn't be able to be here and have work with such an amazing team. So thank you so much for your attention.